next on AM 1480 WLEA, the Newsmaker Show. Here's Brian O'Neill.
And we are live in the studio with Kate Krieger and Lindsey Vogel from St. James, and we're working to get Dr. Avice O'Connell from the U of R on. First, saying good morning to Lindsey. Lindsey Vogel, Director of Imaging Services at St. James. Lindsey Vogel, first explain to our listeners who might not be familiar, what is imaging for hospitals?
What we are referring to today is the Women's Imaging and Breast Center that we will be introducing at the MOB, the Medical Office Building, and that will focus on women, not only in regards to breast imaging, but also OB and GYN imaging as well. This building is actually magnificent. It is 5,000 square feet. Services that we will be offering there are screenings and diagnostic digital mammograms. We will provide tomosynthesis, which is 3D mammography. Biopsies will be performed there, both under mammo and ultrasound guidance. Other imaging that we will offer will be directed towards those OB and GYN patients. And again, this is these are new machines, capabilities in which we did not have in the past. Addition to that, we'll also offer DEXA screenings, which is bone densitometry. And these studies define whether patients have osteoporosis or osteopenia. And
it's St. James Hospital on the Newsmaker Show this morning. We have with us Lindsey Vogel, Director of Imaging Services at St. James. We also have on the line with us now Dr. Avice O'Connell from the University of Rochester. Good morning, Dr. O'Connell.
Good morning to you all.
All righty. Well, we're talking about women's imaging and the breast center that'll be coming to Hornell. Can you tell us a little bit about that, Dr. O'Connell?
I would be delighted to. So we have offered breast imaging services in the Rochester and surrounding area for years, and we have been in Hornell before, but we're looking forward to this brand new center which will have the latest in mammographic imaging. People may have heard about 3D mammograms and ultrasounds and dense breasts and risk, high risk, low risk, medium risk. We will be available to bring all of our expertise to the area starting in June. What's very important is that we are trying to remove any sort of barriers from women and also give them information, but any barriers to getting a regular screening mammogram so that if they're unlucky enough to get breast cancer, we find it at the earliest possible time. So jump in any time, but meanwhile I will just say that there's a lot of media. We love the media, but sometimes the media says things that women want to hear. They want to know that they don't need a mammogram yet. They can wait till they're 50. I'm here to tell you that they need to start at age 40. Sometimes the media quotes doctors and experts as saying they don't need to go every year. Let me just tell you, if a cancer starts growing in that 2-year interval, you would wish you knew, so you want to come every year. So we need to tell people that you can come get your mammogram once a year. You don't need an order from your doctor. You can actually order it yourself, believe it or not. So you can have your mammogram every year, and we will be there to answer your questions and to do additional testing if needed.
Dr. Avice O'Connell from the University of Rochester Imaging Department on with us this morning, along with Dr. Lindsey Vogel, the Director of Imaging Services at St. James. Now, you have a new radiologist coming to St. James, Dr. Ruby Belton, and this question is either for Lindsey Vogel or Dr. O'Connell, whoever wants to answer it. Tell us about Dr. Ruby Belton.
Well, since I've known her for many years, let me take this one. So Dr. Belton is highly, highly experienced. She's been doing breast imaging for 30 years. I don't think she'll mind me saying that because because I'm the same. We've been doing breast imaging since the days of film, and then we went to digital. Now we've gone to tomo for some people. So she's highly experienced. She takes care of her patients above all else. She's the greatest communicator. She'll tell people what's going on. She'll make sure their doctors know what's going on. She's going to be wonderful. She will start in July because she has to fulfill her other commitments first. So once she starts in July, she'll be there a couple of days a week, at least initially, and we'll let everybody know which of the days there'll be a doctor there, so that if they have anything to discuss or if they want to have the results read right away, there'll be certain days. So Dr. Belton will be there. As I say, she will have all the skills needed to give people the best treatment.
You know, you talked about the old days versus today's high-tech, and Dr. O'Connell, wanted to ask you about that. I can tell you from having been in radio for the amount of time that you talked about having been in medicine, when I first started, we had tapes, we had reel-to-reels, and we used to have to splice and edit, and it took forever. So basically, if an announcer made a mistake, you started from the top. Now everything is on an MP3, basically it's on a computer graph. You make a mistake, you just highlight and delete. Now that's the easier of the two jobs. Medicine is much more difficult than radio, but I'm guessing that you may have some stories or things to tell us about, improvement since the previous days. What's the differences between 30 years ago and now?
Oh, in 2 minutes, right? So, well, the first thing is, we used to have to run to the darkroom and develop all our film, in a big developing tank. And, of course, that added time to every exam. It meant there were delays in readings, too, because the actual film had to be brought to the radiologist to read. Huge development now is that because of the Internet, because of our fabulous connectivity, I can look at a mammogram right now that's being done at Hornell. If anybody needed a second opinion, or if it was a snowstorm, we weren't there on the day, we can read the images 50 miles away, and we can read them just as well as if we were there. So
can you do it as it's happening? Can you see the, if someone goes in for whatever the test is, can you see it as it's happening, or do you wait for the results to be sent?
No, each time an image is taken, if we're connected to watch it as it goes, if Lindsey does one view, we can look at it, second view, look at it. We tend to wait till they've done the 4 views, if 4 is the exam. And then if we're not right there and the person has a problem, they can phone us up, and we can look at it right there when we're up in Rochester. So I think that's the biggest thing, that there's connections. If somebody wants to, sometimes we want another radiologist to take a look, and we can call up and say, just open this one up, and what do you think this, And so we do sometimes actually do sort of second opinions immediately between ourselves. So I think that's the biggest thing. And the other biggest thing is that even though the patients can go and have it used to be you had to take a day off and travel miles and hours to get to your appointment, and then wait a couple of weeks to get the result. So all of that has been improved. But technically, from the actual image point of view, we're seeing smaller and smaller things, and we're more aware of problem cases where if somebody's got very, very dense breast, like a snowstorm appearance, that we know to tell that person, and that's the dense breast legislation. We know to tell that person, listen, your breast is so dense that you have to know that you might need another test, like an ultrasound. So we know more. We're trying harder to find smaller things. We want to find all cancers before they can be felt, because anybody can imagine the treatment will be better for something that's too small to feel than if you wait till it's the size of a walnut and you can feel it yourself. So that's a big improvement. The treatment is better too. So the combination of earlier finding and improved treatment results in a 40% at least improved mortality. So 40% less women die of breast cancer today than used to 30 years ago.
Amazing news. We're talking with officials from St. James Hospital. We have in the studio with us Lindsey Vogel, the director of the imaging services at St. James Hospital. And on the phone with us is Dr. Avice O'Connell, University of Rochester imaging director. To bring Lindsey Vogel into the conversation, Lindsey, want to ask you, as far as the new St. James goes, the new St. James building, and also the medical office building there in the old Kmart Plaza, will there be new services, or are you doing all these same things at St. James on Canasteo Street, or will you be transferring the same services from Canasteo Street to the new St. James, or will there be new things at the old Kmart location?
offer general radiology, general ultrasound. And at the MOB, our focus is to accommodate the GYN, the OB, and the breast imaging. The services that are provided at St. James currently, we do have mammography there, and we also have bone densitometry. Those two services will move from the hospital, and they will relocate at the Women's Imaging Center.
Talking with Lindsey Vogel, Director of the Imaging Services of St. James, and also Dr. Avice O'Connell from the University of Rochester. Going to take a quick break. We'll be right back.
The Ryan Agencies, your local, independent insurance agencies. The Ryan Agency employs 15 of your friends and neighbors. They live, shop, and support our community. When you buy insurance from the Ryan Agency, you support local families. Contact the Ryan Agencies today, your local source for all things insurance.
Insurance protection you can rely on. The Ryan Agency.
Checking in now with meteorologist Rob Carolyn, who says it's going to be a really nice day.
It is. Very nice day overall, Brian. We're doing okay out there right now. Fair amount of sunshine. There's a little bit of cloudiness off to our east, but that should move away from us. Got some cloudiness up over Lake Huron, back across the UP of Michigan and into Lake Superior. That cloudiness will head our way late today and interrupt our nice weather tonight. Good news is that system should go by tomorrow morning. We'll get back into some sunshine and then look forward to start to warm up. Temperatures are going to get progressively milder over the next several days. All in all, we'll call today partly sunny, Brian. We're 60 to 65. Sun came up this morning at 5:42. It'll set tonight at 8:26. We're going to turn cloudy overnight. May see a few showers, especially after midnight. Lows, they'll drop back down to about 45 to 50. Tomorrow, any showers end early. Turns partly sunny, mild, high 65 to 70 tomorrow afternoon. Tomorrow night, clouds, maybe a shower, 40 to 45. Warm front to our south will produce clouds on Saturday, maybe a couple of showers, 60 to 65. Stays mild into Sunday, Brian, but there's still a chance for some showers.
And we're doing a live Newsmaker show this morning with officials from St. James Hospital. We have with us Kate Krieger, Marketing Director, who's in the studio with us. Also on the air, Lindsey Vogel, Director of the Imaging Services at St. James. And we're glad to have on the line with us Dr. Avice O'Connell, University of Rochester Imaging Director. Dr. O'Connell, just to take a quick second, we have a lot of Hibernians listening. And I just wanted to ask you, my grandparents were from Dublin. Noticed your accent. Just wanted to ask you where you were from in Ireland.
Oh, right. So I received my medical degree from Trinity College in Dublin, and I came over here for radiology training because there was a lot more technology than Ireland, which at the time was quite poor. So yeah, I was born there. My husband was born there. We go visiting 2-3 times a year. It's a lot easy. It's just as easy to get there. So everybody who thinks like I've been putting off going to see my, where I came from, it's the same distance as California.
Yes, I have Irish cousins in San Francisco, California, and Irish cousins in Dublin, too.
Yeah. Well, it only takes 6 hours in the flight, so it's actually an easy trip. And anybody who's been waiting to go there should just go because, it's quite different from here, isn't it?
Sure thing, sure thing. Glad to have you on. And we're talking this morning about the exciting news for St. James Hospital. They're working on that new hospital building. You've got a grand opening coming up, and throwing this question out to either Lindsey Vogel or Dr. O'Connell. When is the grand opening going to be?
Our grand opening is actually going to be June 10th. We do anticipate to have an open house open to the public on June 6th, and that will be from 3 to 5.
Okay, that's great. And the new hospital, can't say enough great things about the medical office building, hearing lots about that. And the new hospital, how are things going there?
Well, this is Kate. The construction on the new hospital is coming on splendidly. We're about 65% complete with construction at exterior and interior. We did a tour earlier this week and got to see where the OR, the operating rooms are going to be, and the lab and the lobby and imaging services, and it's really starting to take shape.
That's terrific. We have with us today from St. James Hospital, and that was Kate Krieger, the marketing director. We also have with us Lindsey Vogel, director of St. James Imaging Services, and Dr. Avice O'Connell from the University of Rochester is on the telephone with us. Dr. Avice O'Connell, this question for you. All this new technology and all this new, and the new hospital and the new imaging techniques, what does this mean for our area?
Well, again, it's quick access, so it's no excuses. I mean, Governor Cuomo did a big campaign a couple of years ago, the No Excuses campaign. We want people to have, the information that all women need a mammogram starting at age 40. And there's no charge, no cope. That's important. Again, Governor Cuomo made this clear, that if somebody has co-pays and deductibles, mammogram is the one thing they don't have. Now, having said that, there is few outliers with the tomosynthesis, but in general, a regular mammogram is covered once a year. Again, no copay, no deductible. So we would like people to feel that they can have access. They don't have to travel a distance to get the new technology. It'll be the newest machine out there. So from that point of view, and they will also get the most experienced radiologist. So a combination of both is really good. So information, technology, experience, I think we're bringing it all there.
When you think of people who are afraid to go to doctors, what are the reasons for that? And what would you say to somebody who might be listening who's a little bit scared to think about, the possibility of being checked up because they just don't want to hear bad news?
Well, there's that. There's always afraid to put your head in the sand. But the thing is, if you have breast cancer, it's not going to go away. You should really try and find it. Now, if you don't have breast cancer, it's a great feeling. Peace of mind is a great feeling. So that's number one. But the biggest misconception out there, and I see it all the time, if you say, I have no reason to go, I breastfed my kids, nobody in my family ever had breast cancer, I'm a healthy person, I do everything right. That should be enough to keep somebody healthy till they're in their 90s. But unfortunately, breast cancer doesn't care about that. That more than 3/4 of women, this is really important, 75% of women who are diagnosed today with breast cancer have no family history and have no big risks. They're just regular people who did all the right things. So my message is, you don't know if you might be somebody with cancer. And if it's there, it's just going to grow. So number one, you might get it. It could be you. And number two, you'd want to find it as small as possible. So I think that's really the big message.
And down to the last couple of minutes, and I'm throwing this question out to either Lindsey Vogel or Dr. O'Connell, the bone density screening, that's largely, I guess, aimed at women patients, but some men too. Tell us about that.
Well, let me tell you, yes, some men can get osteoporosis too. So if you have osteoporosis, you're at risk of having a fracture by tripping over a rug, tripping over your dog, going down a step funny. So if you have osteoporosis, you need to know about it so you can take active measures. And by active, I mean you need activity, weight-bearing activity, enough calcium, enough vitamin D. But if you don't know, again, from the outside, you don't always know. If you're all bent over, yes, you have osteoporosis probably. But women over 60, postmenopausal women do get osteoporosis. And so it's better to get another one of those things. Because if an older person falls and breaks their hip, they don't do very well. They get pulmonary emboli, they get pneumonia, their activity has changed. So it's actually a life-threatening disease. Not the fracture doesn't kill per se, but some older person who gets a fracture will many times never regain normal activity. So I think it's another one of those in a good, healthy environment. You want to know what your health is, and you can get scanned. For bone density, the reading comes out, your doctor tells you what to take. So another one of those maintenance tests with no symptoms necessarily, that you can't feel it. So we feel like those two things for women, breast mammograms, bone density, very important.
We're out of time today. I want to thank Dr. Avice O'Connell, Kate Krieger, and Lindsey Vogel, all from St. James and U of R, for coming on today.
Thank you.
Thank you for having us.
It's AM 1480, WLEA Hornell.